Okay, welcome everyone. My name is Petra Ritter. I am the coordinator of the Testing and Experimentation Facility for Health, AI and Robotics, TEF-Health. And today we have a webinar on call 3. This webinar will be recorded and you can later also find it on our YouTube channel. So as you all know, probably, we have the EU AI Act in force, and this comes with several requirements for AI system providers. Here we have a very high-level view of some of the requirements that are articulated in the AI Act. For example, human agency and oversight, technical robustness and safety, privacy and data governance, transparency, diversity, non-discrimination and fairness, societal and environmental well-being and accountability. And this needs to be all documented by AI system providers. There's a special situation for the healthcare sector where all medical devices that contain AI systems are classified as of the present situation by the AI Act as high risk, and therefore they need to undergo CE certification with respect to these requirements. So this is a big hurdle and a challenge, and therefore the European Commission came up with the idea to establish testing and experimentation facilities in different sectors to support the companies, but also the notified bodies in validation and testing AI systems. TEF-Health was established in 2023. And it is funded with 60 million euros over 5 years and then will become sustainable. Presently, TEF-Health comprises 9 member states. It is led by Germany, Charité University Hospital, Berlin. Other countries are Belgium, France, Italy, Portugal, Czechia, Finland, Slovakia, and Sweden. And it's a collaboration between 52 private and public partners. Here you see the logos. We work with certification bodies, with some standardization metrology authorities. We have several hospitals on board in order to provide the testing and validation environment in real-world facilities, namely clinics and hospitals. And what you see here is that the AI system life cycle. This is an illustration by the FDA, but of course in Europe it is very similar. There are different phases that are indicated here and which come with obligations or checklists that need to be fulfilled by the AI system providers. And the task of the TEFs is very clear: to support in validation and testing of the AI systems to make sure that they are trustworthy and functional. And therefore, TEF-Health set up a catalog of services and the services itself. These are some overarching service categories: technical testing, clinical testing, including clinical trials, regulatory support, and data access. And of course, all these different service categories are linked to access to either physical infrastructure, also virtual infrastructure, but also consulting services. So in order to make this all well organized, we have established a marketplace, a single marketplace, a single entry point for all the now 360 service offerings from 32 service providers in 8 member states. This marketplace can be discovered via the URL tefhealth.eu. And there you will find different possibilities to explore our service offerings. For example, here, this is our website. You will find the button Search for Services, and this brings you to our public service catalog that can be accessed without any registration. Yeah, here you see there's a search interface where keyword search can be performed to easily discover the services that are of interest. We have presently 360 services listed by 32 organizations. We have the possibility to filter the services, for example, for calls. Today, the focus will be on call 3. So if you want to know which services are provided via call 3 with discounted, subsidized prices, namely for free in this case of call 3, then you can just filter for call 3 services and you will identify all the services of relevance for today's webinar. All the services have very detailed descriptions. So if you click on such a card, you will discover a lot of more information, including prices and also the discounts that are being offered via the open calls. Sorry. So now speaking of discounts, the discounts are provided via state aid, and therefore they need to be provided in compliance with the state aid regulations and the European Union. And in order to make them state aid compliant, they need to be transparent and democratic, and therefore they are organized in the form of calls where the companies can apply for receiving the state aid and receiving the services for free or at discounted prices. As mentioned, we have 3 open calls that you can discover via this button on our website. The first call provides access to Portuguese services. Why did we split this? There are some national requirements that are a little bit different from the other call requirements, but the Portuguese call is also open to all EU and the European Economic Area. The second call gives access to all the services of the different member states that are part of TEF-Health. And now we are very happy that recently in January we opened the third call that provides access to the French data gateway provided by the French Health Data Hub. The user journey for our company customers is very simple. So first, it is required, if you are interested to access these services, to create an account under tefhealth.eu. Then you can select the services of interest. You have a shopping cart where they can be added. And then you can decide if you want to go via the fast track and pay the full price for a service, or you go via subsidized access, which is organized via the open calls. And then you have to fill out application forms also in the platform and provide certain additional information to show that you are eligible for state aid. In both tracks, the matchmaking period follows. This means that the applicants, the customers, are connected with the actual service providers and can exchange about the very concrete and precise requirements of the demander, the company, and how they can be matched by the supplier, the service provider. If such a match has been identified, a service level agreement is being signed and the service provision starts. And this brings me actually to a little video that shows you very practically how this application works in our platform. It lasts about 2 minutes and I will play it for you now.
Welcome to the TEF-Health portal. This guide will demonstrate how to browse services, apply for discounted support, or submit a quick direct service request. We commence with registration. Enter your work email, set a password, and verify your email by following the confirmation link we send. Upon logging in, you will land on a dashboard composed of various cards, each serving as a shortcut. The card labeled Request TEF-Health Service opens the Service Explorer, which functions as your catalog. Within the Service Explorer, the left sidebar contains filtering options, a search box at the top, followed by discount calls, if applicable, category toggles, physical, consulting, virtual, service type, country, provider, and offerings. Utilize these filters to narrow down the list. On the right, you may switch between card view, a sortable table view, or institutions. Clicking any service card opens a detailed modal displaying the logo, pricing, operational information, and options to select or bookmark. Close the modal to continue browsing. Select multiple services if you intend to submit a discounted application. When satisfied with your selected services, click the Apply for Discount button that appears, which opens the application form pre-populated with your chosen services. The form guides you through inputting company and contact information, product basics, readiness level, TRL, service requirements, data needs, eligibility checkboxes, and consent areas. You may save a draft at any point. Once all information is complete and accurate, apply for review. For a single service at full price, return to the Service Explorer, select the service, and choose Request Service. The expedited form is concise, requesting organization, product, contact details, and confirmation. Submitting the form creates the request instantly. Track the progress of your requests by opening the My Service Requests section. Discounted applications are organized by stages: draft, submitted, under review, and accepted. Fast track requests display their own status line: draft, submitted, accepted, or rejected. Clicking any entry reveals its details, messages, and, if permitted, the option to add more services. Once a request is accepted, delivery and follow-up are managed within the service overview area, where items are grouped by operational status: planned, in progress, or completed. This separation ensures clarity between execution and intake. If assistance is needed, each record includes an Ask a Question button for contextual support. A help desk section is available for addressing broader concerns. In summary, utilize a discounted application when seeking financial support for multiple services, or opt for a fast-track service request for direct provision. Register now and explore our services for testing and validating your AI solution at TEF-Health.eu. Welcome to the...
Okay, this brings me to the last slide. It's my pleasure to now hand over to Valentin Fack, who will actually present to you the very precise services, namely the access to the French national health data, also related consulting and use of secure processing environments. Thank you very much. It's your floor, Valentin.
Thank you. So I will share my screen. Can you see my screen? Yeah.
Yes, we can.
Okay. I will just try to move the bar so I don't. Yeah, we will be fine. So let me introduce you the purpose and the scope of the call 3. So the objective is to subsidize high-level data services that are usually cost prohibitive for smaller companies, with the aim of providing technical proof needed for clinical effectiveness by using the SNDS, so the French National Health Data System, to also help companies to meet the strict transparency and robustness requirement of the EU AI Act and the medical device regulation, and support the transition from TRL5 to a market-ready product by providing the computational power and data depth. So selected projects will have access to our services, including an SPE, so a secure processing environment that complies with European regulatory requirements, regulatory, scientific, and technical support, computing resources, analysis and visualization tools, secure access to the health data, and support from the Health Data Hub teams in promoting and disseminating the results. To share with you the eligibility criteria, so there is an application form, so we need a complete application file that must be prepared in compliance with the required format with the TEF-Health platform. The solution, so AI and robotics solution must have a minimum of TRL of 5, and it's self-declared. And the SME, so the company must be an SME according to the EU definition, and the SME must be legally incorporated and established in an EU or EEA member state. Ownership and shares must not be held by entities outside of EU EEA, and the SME must provide a formal declaration proving that they have not received more than 300,000 euros in state aid over the last 3 fiscal years. To share with you a tentative timeline, so today is the information webinar, so we have gone through the introductory session and guidance on completing the application file. The deadline is on the April 30th, and we need to ensure all materials are submitted before the final cutoff. The jury review will occur in May, so a panel of specialists will evaluate the submitted application, and in late May we have the announcement of the results. So the selection outcome will be finalized and communicated. So to go a little bit in more in depth in sharing with you what is the Health Data Hub. So the Health Data Hub is a public health data service and is part of the TEF-Health Consortium. So as you may know, the uses of health data are increasing, and it has become essential to ensure access to data sources as quickly as possible. The Health Data Hub was created at the end of 2019, and it is a public body that its main goal is to facilitate the access to health data for projects in the public interest. It was open following the granting of open access to the French National Health Data System, so the Système National des Données de Santé, SNDS, in 2016. So it relies on three main pillars. So a single gateway for health data in France, a secure state-of-the-art platform, and an access to the SNDS, one of the world's largest healthcare claims database. To give you a bit of a figure, so there are actually 235 projects supported by the HDH, and around 36% of them are based on AI methods, and 155 use the technology platform, so the SPE that we have, the secure processing environments. So what is the French National Health Data System? So it's a database that is proving a comprehensive view of the healthcare journey for the entire French population, so around 67 million people over a maximal historical depth of 20 years, and the data is pseudonymized. The historical SNDS is relies on three main databases. So the all health insurance reimbursement information, the hospital stays, and the causes of death. And each databases are linked to the other. And there are also nationally exhaustive databases linked with the historical SNDS. To date, these include the CDEP, so COVID-19 National Population-Based Screening Information System, and the COVID Vaccine Information System. So both of these two stream are the SNDS main database. So how is the health data being used in practice? So it's the only French cloud technology platform that provides health data projects with access to elastic storage and high computing capacity that allows different data sources to be linked. It is designed for use by a large number of users while meeting the highest security standards. I will share now a few examples of use cases. So supporting healthcare professionals in an increasingly complex clinical environment with use cases such as the characterization of alerts of drug interaction based on the main SNDS database, saving time, improving screening, and reducing diagnostic delays, notably through the development of a diagnostic support tool for 10,000 MRI. Develop early warning systems for patient follow-up, including the development of a warning tool for healthcare professionals based on data from connected medical devices annotated with medical administrative data. Offer patients the best long-term treatments with the use cases comparing care path using cohort data enriched with medical administrative data when clinical trials are not possible. So today, the services eligible to selected SME through this call at a price reduced to €0 granted in compliance with the EU de minimis state aid regulation. So we have the support for simple use case, including secure processing environment use without access and or linkage to the SNDS main database. But we have also the support for complex use case, including secure processing environment use with access to the and or linkage to the SNDS main database. As extra services that we can top on the previous one, we can help in protocol writing, giving a comprehensive scientific protocol authorship, generating detailed, technically sound protocol tailored to your research objectives. as well as protocol review for rigorous evaluation of experimental design, statistical power, reagent specificity, and controls to ensure methodological integrity and data reliability in identifying potential biases or flaws before study commencement. And also analysis, so in-depth data analysis expertise, specifically focusing on the exploitation of the SNDS, so the French National Health Data System, and if applicable, its linkage with other datasets. So we will be there from the beginning to the end of the project. So as the first part, or when we search for data, so identification of suitable data, possibly from the catalog and of suitable partners, identification of regulatory procedures, linkage processes, data preparation, the support for data preparation, standardization and quality control, deployment of a secure project space, provision of data management and analytical tools, and support for data use, training, support for opening up the results if desired. To explain a bit more, what is the technological platform? So it is a cloud platform that is dedicated to public interest healthcare research projects that enables the ingestion and hosting of pseudonymized health data under security conditions that comply with the CNIL, so the French Data Protection Authority requirements. A dedicated analysis space for each research project with a range of tools for exploiting and visualizing data, and a database storage for multicentric use cases. So it's part of the Health Data Hub's mission to simplify access to healthcare data in the state-of-the-art technological and IT secure environment. So to go a bit deeper of what are the tools available on the platform. So we have tools dedicated to programming languages and IDEs, big data infrastructure, data visualization, data storage, images, and collaboration. The technological offer elasticity of resources as a major advantage of our cloud services. So the virtual machines made available for projects are adjustable. So the project team will estimate the needs according to the study, the volume studied, the tools used, the data format, and during the course of the study, the resources allocated can be adjusted. Currently, there are around 10 different types of machine on the platform. I can get 2 to 64 CPU cores number of processor, 16 to 512 GB RAM, 1 to 4 GPUs, 16 core, 128 GB RAM. And the Spark tool allows you to adjust the power available by distributing calculation across several machines. So the maximum power used on the platform by a project at a given time. So the biggest one we had is 480 CPUs for the project called HugoShare. Let me share now an example of a use case, of a SME use case. So to give you a bit of information on the key stages in the healthcare data project with the HDH. So there is a kickoff at the beginning of the project with the HDH, and then we start the partnership agreement phase. Then we sign the agreement, then we start the regulatory procedures. Then we have the CNIL authorization after CESRES opinion. Then we start the data collection, transfer, and transformation phase. Then the database is ready to work. Then you can perform the realization of the study. Then we have the finalization of the study result. And after that, you can share the results. So the first 3 phases last from 8 to 11 months. And we have some feedback from HDH on the key stages of the health data secondary reuse project timeline. So the preparation of regulatory file before submission to CESRES usually lasts 2 months. CESRES opinion lasts 1 month. CNIL analysis for authorization lasts 2 to 4 months. And preparation of CNAM data and agreement with CNAM can last 3 to 6 months. And after that, data ingestion and HDH platform deployment lasts 2 weeks. So these timelines may vary depending on the complexity of the project, of course, but this is to give you a bit of idea of how long does it take. So to share the HEDRO project, so the HEDRO project aims to define heart failure episode leading to hospitalization for patients with pacemaker in a context where existing solutions generally do not allow such prediction. So there were 45,000 data points from pacemaker and we had in regards 3.8 million data points from French patients from the SNDS. With the support from HDH and the CNAM in performing the data linkage, we improve the matching rate from 50 to 85%, and then we create a database linked to the SNDS that we had on our platform. Then we developed the algorithm on the HDH technological platform with support from the HDH, and then an application was submitted to the FDA for CE marking for commercialization for implicity that allows to detect of high-risk patient and intervention and at the end reduce the number of hospitalization for patients. We wanted to share a bit of a reminder regarding the call 2 and especially get a bit more information regarding healthcare data landscape in France among TEF-Health partner. So we have 3 main sources of data. So in-hospital data, primary care data, and follow-up care in the city, and specific research data sets. So in hospital data, you have medical and administrative data, but you have also as well real-world clinical data. And both of these data in hospital level are available at hospital clinical data warehouses. Regarding medical and administrative data from in-hospital data and primary care data and follow-up care in the city, at the national level, they are stored in the SNDS main database, so in the Health Data Hub. And for specific research dataset at the research level, they are stored within the research institutes. We have also real-world clinical data that will be made available. This is not a written in stone situation. This is something that is moving really rapidly, and some real-world clinical data might be at some point available through the Health Data Hub.
Yeah, and I just wanted to add that the interest of the technological platform of the Health Data Hub is also to, on our platform, it's possible to have data from the SNDS main database, but also from hospital clinical data warehouse if it's your partner, or real-world clinical data belonging to SMEs, for example, and it's possible to link them with the SNDS and to process them on the HDH platform.
Thank you. And in align with this, we wanted to share the one of the scope of TEF-Health Call 2, the data provision services. So these services allow to real-life data collected in hospital across multiple clinical domains. Synthetic data generated following medical expert recommendation are also available, and the consortium includes 9 hospitals with 3 additional data providers that are in direct access with the health organization. So they provide main type of services regarding data provision services. So datasets collection and provision, synthetic datasets generation, datasets integration and accessing. And they have a webinar coming regarding the specific data provision services that will occur the 3rd March 2026. I will not read all the partners offering these services, but you get the idea. And this is the end of the presentation. Do you have any questions?